we will present a case of endometrial polyp. Patient 24-year-old came with a history of infertility. On TVS scan, that is transvaginal scan, we incidentally saw an endometrial polyp lying in endometrial cavity. The patient had a history of infertility, while as we can see, normal anteverted uterus is seen with midline endometrial echoes. A small hyperechoic mass is seen in the endometrial cavity lying near the fundal region. Diffuse thickening at this site of endometrium can be noted. Rest of the endometrium and cervical canal appear to be normal. On Doppler study, minimal vascularity can be identified. This is a case of typical endometrial polyp which was identified on transvaginal ultrasound. Endometrial polyps are growths within the endometrial lining of uterus, and they can be identified through ultrasound, particularly through transvaginal ultrasound. Features of polyps are they appear as hyperechoic masses which are well defined, round or oval, lying within the endometrial cavity. Endometrial thickening may be visualized at the place where polyp is located. Some polyps may also contain small cystic areas. Polyps may be pedunculated or sessile. The pedunculated polyps are attached to the wall by a thin stalk which shows vascularity on color Doppler. Sessile polyps are normally broad-based. Color Doppler can show single feeding vessel going into the polyp. Saline infusion sonography may be used to provide better contrast and visualization for polyp to be seen as a filling defect within the fluid distended endometrial cavity. Treatment depends on factors such as patient symptoms, age, and size of the polyp, and concern for malignancy. In cases of premenopausal women, watchful waiting is recommended, especially if there is no suspicion of malignancy. Regular follow-up ultrasound is advised. Medications like hormone therapy, progestins, and gonadotropin-releasing hormone agonist may be prescribed for temporary management of abnormal bleeding. Hysteroscopic polypectomy is the most effective treatment. In certain cases, dilatation and curettage is also recommended. Hysterectomy is done when there is a complication or suspicion of malignancy.